All right, so what about this one? 32-year-old pregnant woman with fever, vomiting, tachycardia, suspected pyelonephritis. So what sort of special issues does this woman have? She's pregnant, right? So what is that? How does that affect anything? So you have to be careful. So we're always careful when we select antibiotics or any medication, but in her we have to be particularly careful that we're selecting an antibiotic that's appropriate for her infection and that won't harm her and her baby, right? And usually in pyelonephritis, it's gram-negatives like E. coli or Klebsiella or something like that. And usually we could use a third-generation cephalosporin, so ceftriaxone would be a drug we probably use as one of the safest choices. You can't use fluoroquinolones, again, because she's pregnant. You can't use the macrolides because it will affect the baby for sure. You could use it like Piptazo or something like that, or you could use Bactrim. We have a particular dislike for Bactrim in my house because my wife and I took care of a lot of patients who had TENS, really bad disease you can get very rarely from Bactrim. So when Bactrim was brought up, everyone in my house was like, no Bactrim. But you could use that. The other thing you worry about in somebody with pyelonephritis is whether or not that kidney is obstructed. Is that why she has pyelo? And whether or not we need to drain it. Okay, so you could see that with an ultrasound, and then you could perk the kidney. How about a 45-year-old diabetic patient with erythema and pain over the right chest and shoulder who's hypotensive and confused? So this patient, I worry about. So if you examine the patient, you're going to find that not only is this really painful, it's painful outside the area of where the redness is, and there's even some crepitus. So there's like some gas deep to the tissue. This is very concerning for a necrotizing soft tissue infection or necrotizing fasciitis, right? So the treatment for necrotizing fasciitis is what? So I'll give you a hint. We take care of them in the SICU usually. They don't usually take care of them in the MICU. It's debridement. Why debridement? You get all of the dead stuff because all that dead stuff is just going to be a source for more and more bacteria, right? So this is a big problem. So we do early debridement. We give broad spectrum antibiotic, gram-positive, gram-negative treatment with vancomycin plus a beta-lactam and beta-lactamase inhibitor. But usually it seems we use more carbapenems there. And then we add clindamycin because we worry about in a patient with this kind of infection that they're growing group A strep, and actually clindamycin will basically keep the bacteria from manufacturing the toxin that makes those folks so sick. So that's why a lot of times in these patients we do these big debridement on, they're also on clindamycin, which is not a drug we use a whole lot of. So this is a patient that I really hope I don't have to take care of, but a 28-year-old with Hodgkin lymphoma develops neutropenia, fever, and hypotension after chemotherapy. So what's your main concern in this patient? So why are they at high risk for infection? So it's immunocompromised.